Evening, everyone. Thank you, everyone, for joining us for the MSF briefing series. Focus. My name is Jihan Bang from MSF's Communication Department. First of all, I would like to inform you that today's event will be interpreted in Korean and English, so you can switch between Korean and English by pressing the interpretation button at the bottom of the screen. Yemen's conflict is the focus of today's briefing series, and Yemen's conflict has been ongoing since the country's civil war began in 2014. There have been a number of casualties and displacements over the last 8 years, and Yemenis are living in a humanitarian crisis with essential healthcare systems collapsing. We've organized a focus briefing to share with you how MSF is working in Yemen and to share what's going on the ground. Today's briefing will include a presentation from MSF's Yemen Head of Mission, Eric Ouannes, as well as an opportunity to ask questions that you leave in the chat. During the presentation, please feel free to leave questions in the Q&A box at the bottom of the screen, and we will do our best to cover them during the Q&A session. Okay, without further ado, I'd like to turn the microphone over to our field director, Eric Ouannes.
Hello, everyone. I hope you can hear me well. I'm Eric Ouannes. I'm the head of mission in Yemen. I have been working in Korea a long time ago. I'm still a member of the board of MSF Korea and also involved with MSF Japan. I wanted to introduce you a bit the situation, but before I do that, I just want to mention I'm representing only my section, my operational section today, OCG, or MSF Switzerland. I'm not representing the entire operations in Yemen, even though I will give you a glimpse of what MSF is doing in the entire country by MSF Switzerland, but also the other sections. Why I chose this picture as an introduction is because I would like that we focus a bit more on the situation of women in Yemen and specifically the situation of our staff and patients, female, that we have in Yemen. After having presented you our operational response in Yemen. So please let me start the presentation. So this is a bit a picture of the different forces in presence as of end of 2022, early 2023. This map didn't change massively since the beginning of the year. Today, most of the coordinations, except for OCB, MSF Belgium, are based in Sana'a, in the capital, and it's in a Houthi-controlled area. So the Houthi is a group coming from the north of Yemen, and who have progressively taken control of the green area you see on this map, and who are fighting to control the entire country. Of course, other parties in the south, in the west, in the east, in the southwest, in the east, do not really agree with their being in charge of the entire country, and they are fighting. And this has created, since 2014, as it was said in introduction, a conflict for controlling the main resources in the country. The main resources in the country are located in the middle, in Marib. I don't know if you see my pointer here. So here around this area, there is a lot of oil fields and gas fields. So the battle is going on to control, or at least to come to an agreement on how to share the resources and the wealth of this area. There was also a big battle of the control around the coast, the west coast here, along the Red Sea, with numerous ports, seaports, which of course is entry points for business, as well as in the south, a number of entry points also for the oil and gas, but also for business and other commercial activity. Today, the official government is based in Aden, the south, this big city in the south, in the Gulf of Aden. and the government is controlling more or less the blue area, and is still contesting the control of the north of the country, the green. It is mainly an economical battle, but it's also a religious and cultural battle between Shia and Sunni, the Houthis, or Ansar Allah, as we call them, and the green area control. As you can see on the map, um, they are Shia supported by Iran, the south until very recently, who is Sunni, was supported by Saudi Arabia and a number of other Gulf countries. The complexity of the situation in Yemen is coming from the fact that, one, there are a multitude of different tribes and groups fighting to control different kind of territories, as you can see in the map, but also by the involvement of external powers like Saudi Arabia, USA, Oman, United Arab Emirates, etc., and Iran, of course. So this is creating a very complicated situation with a lot of difficulties for us, MSF, to anticipate on political movements. On top of all that, on the gray area, you can see that there is forces or groups affiliated to Al-Qaeda or ISIS, and they are trying to control some areas. They have been pushed from some areas in the green part, not everywhere. So mostly they are not in the green areas, but they remain influential on the borders with the pink area and the blue one. So it's still quite volatile in most of these area, and especially in the blue southwest area and in Shabwa in the center of this map. Considering all that, back in 2014, MSF, since 2014, MSF has decided to step up humanitarian efforts. So here I show a bit where we are located. I will give you the figures a bit later. So this is all the sections. So you can see that we have a massive presence. I think today, internationally speaking, it is the second or the third biggest intervention of MSF in the world after DRC. And maybe Ukraine, I'm not really sure where we are today, but it's one of the biggest interventions in the world as of today. This is a bit the map of all the different interventions. I will come back to that to explain a bit the acronyms that you see, but mostly these are secondary healthcare, primary healthcare. I will go back later. But as you can see, we are a bit everywhere in the country, in the north, in the south, and we are locating in the places where there are little actors or no actors at all to try to maximize our impact. I will just move. So here you have MSF Holland, MSF Spain, MSF Switzerland, MSF France, and MSF Belgium. So the 5 operational sections are active in Yemen, except Waka, West Africa. They are not the 6 operational center. They are not present here, but the 5 historical OCs are present in Yemen today. So the MSF activities today is approximately 120 million USD worth of projects in the country. So it's a massive intervention. Each operational center has more or less the same size, between 20-25 million operation, a bit more depending on what we're doing and year in, year out. We are mostly present on secondary healthcare, including surgical activities. OCG, my operational center, my sections, we are having a very big surgical project in Yemen. We are also involved on maternal and child health. We are involved on primary healthcare. In OCG, we have 12 primary healthcare. Other sections are involved in supporting other primary healthcare centers in the country. We have malnutrition projects within our hospitals or standalone projects because the malnutrition is going up. We have a small IDP project in Marib, but it's a very marginal one so far. It's not the main focus. I saw the questions that were shared with me a bit earlier. It's not a major focus on our intervention in Yemen for a very simple reason, is because the rest of the needs for the Yemeni population are so immense that we have chosen collectively to focus on them. And then in OCG, in MSF Switzerland, we have a mobile emergency team. And in the north, OCP, MSF France, has one in the south. And these emergency teams, they are responding to outbreaks. They are responding to natural disasters, floods, or any other one. And they were supposed to respond to war-wounded crisis, if any, in the north or in the south. These teams have been formed to answer and to complete or to complement the capacity of the regular projects that we have in the country. What I wanted to focus on a little bit and to give you a bit of background beyond the different projects that we're running in the country is the situation that we're facing. Since last April, May 2022, Ansar Allah, the authority in the north, I will focus more on the north and the south because that's where I'm based and that's where most of the problems that we're facing regarding restrictions are located today. They have been imposing restrictions to all spheres of social and political groups, and it affects the it affects the civil societies in many ways. It also affects us, humanitarian organizations, and they have been impacting women and girls. So women are not allowed to move in the country without marham. Marham is person who is from the family, the husband, the father, the brother, the uncle, the person who a woman cannot marry, basically, to make it short. And this applies to us, to our staff, and also to our patients. So I let you imagine that it's more complicated for women to access our medical facilities, and it is more difficult to our female workforce to go from one hospital to another, to attend some trainings in the country, and to move from one place to another in the country. So it is creating it has some impact on the quality of our operations. Women have been imposed since the beginning of this year, black abaya. So the abaya is the long dress that is covering the body of a woman, and the black niqab. Niqab is the veil that is and the hijab, the veil covering the head and the face of the woman. There has been a separation between men and women in ministries and other public offices since the beginning of the year. It has started also in schools, and some education material has specifically been modified, targeting women's rights, obviously to downgrading them. So all the international community so far has fought those measures, tried to not respect those measures, try to find some way out, try to advocate for changing those measures, which are not written in law. They are just oral instructions that were given to the international community and international community staff. So MSF and RCRC, including also United Nations organizations and other NGOs, we have pushed very strongly since 1 year, without much results so far, but until very recently, 2 weeks ago, where we heard that maybe there is some hope that women will be able to move a little bit more freely in the country, but nothing is for sure at this stage. The way we have been affected, so as I said a bit quickly, trainings and detachments were cancelled. So we could not, a detachment is when we detach one of our staff to another country of operations of MSF outside of Yemen. So it has been stopped for more than 6 months. We found some solutions to send some people in detachment because of the needs of the other missions, and we have extremely experienced staff here, but it was really on an exceptional basis. The quality of care was affected. For example, our medical coordinator cannot go to the different projects to train people, to monitor the quality of what we're doing. It had a negative impact on our ability to recruit women for key medical positions. So, for example, midwives, gynecologists. We have been told, okay, well, no problem. If you cannot recruit women, you just have to recruit men. Of course, we disagree with that, and we don't want to have an only male organization. We want to continue to respect rights for women and have a diverse organization and gender balanced organization. And we don't want to just passively accept what is imposed upon us, and we want to continue to fight to be able to continue our medical operations in the country. And that's why I wanted to the following questions that I put in this presentation was to try to share a bit widely in the movement, in the MSF movement, the questions that we're asking ourselves in Yemen, but not only in Yemen, actually, same questions are raised, maybe with a different angle, but they are very similar in Afghanistan and in Iran. What position should we adopt as MSF? Should we accept that women are discriminated in this country, and then we work like that, and we continue like this? Do we accept that every woman should move with a man, and we should pay for the movement of the man? We should pay for his hotel. We should pay for his food, while the woman is going for training from one location to another, for example. Is it rooted in a cultural practice? Is it a religious practice? How is it compatible with the international humanitarian law? How is it compatible with the MSF Charter? We in OCG, at least, we believe that it is not compatible with international humanitarian law. It is not compatible with the MSF Charter. We are a non-discriminatory organization, and we should stand by this principle. But we have also, having said that, we have very big difficulties in respecting our own principled position in the country. And this is what I wrote a little bit further here, is how should we convey our position in the country? Is it just an advocacy effort, a political and diplomatic effort with authorities in the country? Do we go public and push for recognizing the right for women and to maintain our humanitarian space and operational space? Is this a red line in Yemen, or is it something that we should say we don't accept it? If we cannot continue to work with women, we leave the country. And how long do we accept this position? It's been 1 year already. And why we wanted to share this questioning, because it's mainly a questioning today, is also to have with the Q&A and with launching this discussion with different instances in the movement in MSF, in Asia, in Africa, in South America, in Europe, is to have as many as possible opinions and input to help us continue to work in Yemen. Why I chose to put the focus on this topic, it's for a very simple reason. If we don't answer those questions in the coming month, we may be confronted with a very radical decision, and I would rather anticipate these. And without answering this question, I think we will have a lot of difficulties to continue to maintain our humanitarian space and operational space in Yemen. Thank you very much for your attention. I know that there is some questions already, and I'm ready to listen to your questions. I'm happy to engage into a dynamic interaction with you all. Thank you so much.
네, 흥미로운 발표
Thank you
감사합니다.
so much for your insightful presentation. So it's now time for us to respond to some of the questions that we have from those pre-registered participants and also those who are attending in the event. And I would like to apologize to you in advance that we can't answer all the questions due to time constraint. Okay, let's cover the first question. So I'd like to understand about the difficulties that Yemen MSF, staff are having, especially the female workers, due to due to the situation in Yemen. So what are the things that you do MSF do to in order to respond that?
So maybe I can give you an example, because an example will be more understandable for people. Recently, we had to recruit a purchasing officer, so someone who is purchasing stuff that we need in our project. This purchasing officer was supposed to be mobile, in the country. We opened the position to both men and women. The best candidate was a woman. So we had, I don't know how many candidates, 50, 100 candidates. We shortlisted, the normal process. And at the end of the day, we had three last candidates. The first one was a woman, the second one was a man, and the third one was a woman. The team decided not to recruit the first one because she would not be able to move in the country as we needed for the team who needed this position. This was a very long discussion, and we made that decision it was a very difficult decision to make, because of course it's not fair. The best candidate is a woman, but because of the restrictions that are imposed on us, we had to choose the second. Otherwise, we wouldn't have been able to fulfill the objectives for which we opened this position. So that's an example of where we have a problem. Another problem we have an intersection position. An intersection is a position that is hosted in one of the sections of the movement, but is working for all the sections and all the projects in the country. So we have what we call point of care ultrasound trainer. So it's usually a medical doctor with a particular training on gynecology and pregnancy follow-up. And this person is a trainer and is supposed to train various midwives and gynecologists in various projects. This person is based in Sana'a. It's been 1 year that she hasn't been able to train any of the teams except online. But she's not with the teams, practicing with patients directly. So yes, we can do a lot of things online. Zoom is a fantastic tool, Teams as well, and other online tools are fantastic, but they don't replace touching a patient, showing to midwives and gynecologists how to do an ultrasound properly with the proper patient. And this is missing dramatically today. So this is two very simple examples to show the difficulties that we're facing on a day-to-day basis. Is it answering the question?
네네, 그 예로 들어주셔서 쉽게 이해할 수 있었던 것 같습니다. 저희 많은 질문들이 지금
Yes,
들어와
definitely. I think the examples helped a lot in helping our understanding. So I think then we can move on to the second question, because we have a lot of questions, and maybe return back if there are follow-up questions. So the next question, if the war is prolonged, what kind of impact is there on a country's medical system? In Yemen, training of medical professionals, procurement of medical supplies and devices. I want to know the actual situation in Yemen.
Well, it's difficult to answer the question on whether or not the war will continue. I'm not a specialist of the history of Yemen. I don't have this competency. What I can tell you is that today it's difficult to predict. But whatever happens, whether the war is continuing or not, the situation today in the health sector is that worse that MSF will need to continue to be present in Yemen for the next at least 5 years. The health system is dysfunctional. There are drugs that are provided by WHO, by UNICEF, and by other donors, international donors. Drugs are available mostly, but there is a lot of personnel. The personnel is not paid, so the salaries are not paid. So the personnel is not showing up in the hospitals. The personnel is not showing up in the primary healthcare centers. And a lot of equipment is missing in various hospitals. Hospitals' buildings are not maintained. Trainings are lacking. International training, national trainings are lacking. The Ministry of Health doesn't have the means the means to continue to support the health structure and the health network. So the work of MSF is not to replace the Ministry of the work of MSF is not to build a hospital or to train the entire workforce of the Ministry of. The work of MSF is to save lives, is to intervene in emergencies, and to try, by doing that, to train the medical professional with whom we are working. So what we have chosen to do in MSF Switzerland is to work hand in hand with the Ministry of Health. So we pay incentives, so it's a complement of their salaries to MOH personnel in a hospital, and we work with them in the hospital on a day-to-day basis. By doing that, actually, we do a hands-on training, let's say, yeah, and a permanent, continuous training with the Ministry of Health personnel, and we allow the Ministry of Health personnel to continue to work in their own hospital. In OCG, we don't have any private hospital run solely by MSF. We only work in collaboration with the Ministry of Health. So we are trying to do that, and most probably, whatever happens in the country, of course, if the war continues or intensifies, it will be worse. But if the situation remains as it is today, most probably MSF will continue to be in the country for the next 5 years with the same level of engagement that we have.
네, 자세한 설명 감사합니다.
Thank you so much for the explanation. So due to prolonged civil war, a lot of problems are all happening at once, and it's kind of deteriorating the situation in the country. And I'd like to cover the next question. So in the presentation, you mentioned about the malnutrition. Is there a special reason why they are suffering malnutrition in Yemen?
Sorry, I didn't get the question. Can you repeat it, please?
Okay, did you hear? So so in Yemen, the malnutrition is severe. So is there a special reason why they are suffering that? Is there a special reason behind it?
Yes, there are different reasons behind it. First, there is a lack of vaccination. For the last 5 years. So of course, kids who are not vaccinated against measles, against other kind of diseases, diphtheria, etc., they are more vulnerable to these diseases. And there is an economic crisis. There is lack of food in the rural areas. So all that together is making that kids under 5 particularly are more vulnerable to the malnutrition and to the lack of food, and is creating a situation that is a little bit severe. Today, in our different ITFC or inpatient therapeutic feeding centers, they are almost full everywhere in all the sections today. We are a bit fearing because the peak of malnutrition should arrive during the summer. So we are now preparing to answer to that peak everywhere. We have medical structure and we have projects, and our emergency teams are mobilized to answer these malnutrition crises. But the underlying reasons are the impact of the war, the lack of jobs, the lack of money, the economic crisis, and the lack of food globally for the country, and the lack of vaccination for kids.
네, 답변 감사합니다.
Thank you very much for that answer. I think it is definitely an issue that is being brought about because of complex factors just coming all together at once. With such prolonged war, and if such crisis continues to persist, and if we don't really have a predictable end to it, how can MSF make adjustments and make plans for the future?
We're not a development organization, MSF. So what we do is we plan year by year. So what we try to have a little bit more than 1 year perspective, because a year by year plan is a lot of constraints, and sometimes we realize that maybe we should have planned a little bit more than just 1 year to allow us to anticipate on the change. The problem in a country like Yemen, but it's a bit the same in other countries as well, is that the volatility of the context is not really allowing us to make long-term plans. So what we did, at least for us in OCG, is we try to do 2 to 3 years, not really a plan, but strategic orientations, let's say. We try to anticipate on the political changes and to integrate them into our operational programming. So let's say, okay, we draw some scenarios. What are the most likely scenarios? And we will work on these most likely scenarios and adapt our operational response to these most likely scenarios. So I give you a very quick example. If the country separates into 2 different countries, which is one of the options and one of the scenarios that is today on the table, then how do we adjust our political positioning and our operational positioning? As I said today, all the sections of MSF are present on both sides, yeah, of the country, but it's not 2 different countries yet. If it's 2 different countries, if it becomes 2 different countries, then we will have to review the way we are positioned, and probably internally, all sections together, we will have to rediscuss how we engage with Yemen South and Yemen North, whatever they are called in the future. So we are working on political scenarios, and that has an impact on how we position ourselves in the country. But mostly, beyond this political analysis, what is important for us is not really the political situation, it's the need of people. We base our response on what people need and what we see in the people. So if we see that a certain area of the country is most in need because there is a lack of food, lack of water, lack of sanitation, etc., then we will focus our effort. The main driver for MSF still remains the needs of the people. This is the main drivers. And then, of course, we take into consideration the rest of the aspects, the war, the difficulties, the security, and the political aspects.
네, 답변 감사합니다. 이제
Thank you for your answer. And also, we have some different questions from different perspectives. So I would like to understand, curious about the type of personnel that you need the most in the country. So can who are not medical professionals participate in the activities? So it is questions about, I think it's someone who is interested in the field operation.
I would love that Korean people could come to Yemen, but I think unfortunately your government is not allowing that. So I think there is a bit of lobby to do here, even though I know the office in Korea is working on that. But so far, I don't know if it's a Korean person who is asking that, but so far it's not possible for Korean nationals to come to Yemen. I hope it will change in the future. I hope we can also continue to lobby the government in South Korea to change the law and to allow South Korean medical professionals to come to Yemen. Of course, we don't need only medical doctors. We need logisticians. We need nurses. We need finance people. We need HR people. We need all kinds of professionals in Yemen. It has been extremely difficult, and still, as we speak, I have some positions that are not filled, and I have gaps in many different positions. We need experienced humanitarian professionals, whether medical or non-medical.
네, 답변 감사합니다.
Thank you for that answer. I think we do have some questions from the live Q&A. So, is it possible for a woman to be hospitalized without a male? And is a person allowed to work in a hospital without a mahram?
Yes, it is possible, but to reach the hospital, she has to be accompanied if she is coming from another district. So that's the issue. The issue is not really inside the hospital yet, like in Afghanistan, in some places in Afghanistan, but it's to reach the hospital and the medical facility where the problem lies today. I insist on that because the situation is worsening, and we are not sure that tomorrow, maybe, the Houthis will decide that the male will have to be present at all times, and that women cannot be treated by male doctors or male nurses, etc. So we're extremely vigilant and concerned with the way the situation will evolve, because today we can still do it, but we don't know about tomorrow. And what we have seen in a recent month is not really encouraging us for optimism. But on the question from Beatrice, I think, sorry to continue on that, I just want to answer the first part of the question. Yes, it is coming from a radicalization. Yes, they are looking like Islamic radicals. And definitely, yes, there is a connection between Iran, Afghanistan, Taliban, and the Houthis. And people are looking at each other like a mirror, kind of three faces mirror, and looking at what Iran is deciding and doing during the demonstration of women in Iran. Houthis are also looking at what Taliban are deciding, banning women to work with international organizations. And the same, I mean, Taliban are looking at what Houthis are deciding also in Yemen. So yes, there is a kind of mutual radicalization in these three countries, and mutual looking at what is happening in these countries. And we too are exchanging with our colleagues in Iran and Afghanistan to make sure that we are updated on what is happening in these countries, and to anticipate as much as we can the moves, the political moves that will be taken in the country. So it's a very good question, and yes, there is a radicalization, at least until now, because of the agreement between Iran and Saudi Arabia, which happened a bit more than a month ago under the auspices of China. We are a bit hesitant, because that may change completely the picture. So we are a bit we are waiting today. We are in a status quo situation. We are waiting to see what will happen. Things may evolve in one way or in the other. We don't know yet. So, but it's still concerning, and we are still extremely vigilant.
네, 질문에 답변 감사합니다.
Thank you so much for your answer. Okay. So you mentioned about Mahram and the women, and I think we have one more follow-up question. So let's say regarding maternal and child health issue, I think it's going to be difficult for women to travel to hospitals if they have diseases. So to understand what is the most serious maternal and child health issue, and what is the cause behind it, and what is the most needed support in order to solve that maternal and child health issue, I'd like to ask your insight.
That's a very difficult question. I don't know if I can answer the last part of the question. The first part of the question, where we have difficulties, is that a lot of pregnancies and deliveries happen at home. So bringing the woman to the medical facility to deliver is complicated today. So when the woman delivers at home, it's very often done in not ideal hygienic conditions. There is no doctor or medical professional present. Sometimes it happens in a primary healthcare center, if the primary healthcare center is nearby a village and is accessible by foot, and not after a 5 hours walk in the mountains. You know, this is a mountainous country, so moving from one place to another is not that easy. So sometimes you need motorized transportation, whether it is motorbike or car or bus or whatever. This costs money. People don't have the money to pay for this transportation. So the main difficulty today that we face is not really the quality of care, because medical professionals in Yemen are very highly skilled, most of them. Yeah, doctors, midwives, surgeons, they are extremely skilled, and we don't have problems to recruit them. We find them in Yemen. It's not like in other parts of the world. The main problem is the access to the medical facilities for the population, whether it is logistic issues or financial issues. That's the main issue, and that's particularly true for pregnant women and for maternal and child care. So that's why in some of the areas where we are focused on secondary healthcare, because we know that nobody else than MSF can do that work. But we are also opening some primary healthcare to try to refer those patients to our medical hospitals, and to make sure that they can access those medical facilities. We also have some agreements with local NGOs who are facilitating the access to the hospital for the mothers, the pregnant mothers, and for the child. So this is what we do. We also have maternities, not in OCG, but other sections have maternities in different locations in the country where we do the classical maternity work that MSF is doing everywhere. So we're trying to be present a bit on all the different levels and stages of the health system to try to understand what is going on in the country and to adapt our response. I hope I answered the question.
네, 자세한 답변 감사합니다.
Yes, thank you very much for that insightful answer. I think then probably I will present you with the last question. It might be a little bit of a personal question. So as a person who works the mission and as the head of the mission, Eric yourself, psychologically, what are the most difficult parts that come with the job? So on the field in Yemen, what would you say are the biggest or most difficult challenges for?
Well, I just focus on Yemen, because in the past I was in other countries as well. But in Yemen, the most complicated today is the relationship with the authorities. Is the constant negotiation. Is a country where everything has to be negotiated. Is the administrative issues that we face on a daily basis. We need permits to move not only for women but for all the staff. We need permits every single day to move from one place to another. And it's not only for international staff, it's also for Yemen staff. We need permits to open a clinic, to close a clinic, to move from one clinic to another in the same district, in the same governorate. We need permits to get out of the country. We need visas. It's an extremely complicated, administratively speaking country, and everything starts with a negotiation that can last for, in the best case scenario, 1 month, in the worst case scenario, 6 months, 1 year. So that's the most nervously and psychologically complicated. And explaining the reason why an organization like MSF, independent, neutral, rendering medical services to the population, why do we need to go through all these hassle, this administrative hassle, these negotiations? Is the most complicated. The second part, which is also extremely complicated, is the willingness of the authorities to interfere in our own neutrality and independence. They want to dictate us where to go, what to do, and to direct the medical aid that we're providing to where political leaders of the country want this aid to go. And battling that back and pushing them to tell them, no, MSF is an independent organization, and we are deciding where we go based on the needs of the population is a daily battle, and that's the most complicated in this country. But it's not the only country where that's the case. There are other countries coming to mind where we face the same issues, but Yemen is particularly tough, especially in the last 2-3 years.
네, 에릭 우아네스 현장 책임자님, 오늘도 급한 현장 일로 바쁘신 걸로 알고 있었는데, 바쁜 일정
Thank you
속에서
very much, Eric. We know that you're very busy with a lot of things going around. We really appreciate your time, taking your time to give us the presentation, and we'll really root for you here in Korea for your future operations. I think we will close our briefing today. The MSF is looking at a lot of different areas to help the people who are vulnerable from natural disasters and also vulnerable war and conflict situations, regardless of political affiliation or religion. So there are cases that a lot of the hardships get out of the hindsight and the spotlight of the press, and the vulnerable people are left with such crisis and without the level of interest and the support they need. So we really need to look at that, and we need your support to continue our operations. We sincerely thank you for providing the level of support so that we can do what's important in those locations. If you have any other questions on our operations or missions at the MSF or even recruitment, you can visit our website, msf.or.kr. And the next month, on June 22nd, we do have a recruitment related information session. If you're interested in joining us, you could join that event so that you could gather information that you need. So we ask for your continued support and interest in an MSF, and we'll see you in the next focus briefing. Thank you.